ਡਿਲਨ ਕ੍ਰੂਗਰ ਕੌਂਸਲਰ ਨੇ ਸਿਟੀ ਆਫ ਡੈਲਟਾ ਦੇ ਵਿੱਚ। ਉਹਨਾਂ ਨੂੰ ਪੁੱਛਦੇ ਆਪਾਂ ਸਮੁੱਚੀ ਕਹਾਣੀ ਹੈ ਕੀ। Mr. Kruger, Sat Sri Akal, welcome.
Dr. Romana, thank you very much for having me.
Dylan, this is not a new issue. We, I think, discussed it previously as well. This is the fourth time in the same year that emergency department was off, closed for 12 hours. First of all, why does that happen? I think it's a common cause for the whole of the province, but why in Delta all the time? And why you think that if we announce the emergency, that can be the real solution?
It is extremely concerning. Delta Hospital's emergency room had operated without a single overnight closure for decades, and all of a sudden we've had not one, not two, but 4 closures in the same year. It is simply unacceptable. In a country like Canada, which is a G7 nation, where you're expecting that if you pay your taxes, you're going to have access to things like emergency room service, to not have that service available in a city of 110,000 people in the middle of the Lower Mainland. It is not good enough. Once is an anomaly. 4 times is a crisis. It is an emergency. We're asking for help. You know, folks in Delta who are in need, either they're looking after somebody who is ill or unwell, or they're having problems themselves, are unsure whether they drive to Delta Hospital tonight, if someone will be there to support them, or if they'll be told to drive elsewhere. And what ends up happening is all of our residents end up going to Surrey Memorial or Peace Arch and adding to already far too long wait times in those emergency rooms as well. So it's not just a Delta issue. It affects everybody in the Lower Mainland. It's unacceptable. We need better, and we need actually a plan from the Ministry of Health to determine how this will never happen again.
The shortage of family doctors, and I think you are on record when you said that there's no walk-in clinics in Delta. Rest of the problems are probably they are same like our province or this area is facing. And yesterday, if I'm not sure, you tabled the motion, but it didn't go through. Why somebody will oppose it?
I was very disappointed. We didn't even have a chance to debate the motion. The mayor, George Harvey, ruled the motion out of order. He said it's not up to municipalities to declare whether or not we're in an emergency. Well, I don't know what else you would call 4 closures in 1 year other than an emergency. We don't have any access to urgent care clinics in Delta. As you mentioned, we have an existing shortage of family doctors and of walk-in clinics. This is an emergency. It's up to us as local leaders to stand up and say, this isn't good enough. We demand better for our residents. We deserve better. So I was extremely disappointed that the mayor didn't feel this was urgent enough to call it what it is, which is an emergency.
But Dylan, do we have any example anywhere in BC that city can do that? Probably what mayor is saying, understandable. If it hasn't happened ever before, then probably he's a little bit hesitant.
Well, the mayor is incorrect, and he's playing politics. Many cities across BC have used this power in the past. Most recently with the opioid crisis, many cities across British Columbia have declared a mental health and drug addiction emergency in their communities. Now, what this does at the local level, it doesn't give any extraordinary powers to a municipality like it would the province, but it allows us to get the issue on the map. It allows us to tell decision makers in Victoria, hey, listen to us. This is really important. This is what our residents are telling us, that they are in crisis, that it is an emergency, that we aren't getting the attention that we deserve. It's a mechanism that cities have used for many, many years to draw attention to crises in their community. And it's very disappointing that the mayor didn't feel this was important enough to call it what it is, which is an emergency. It is a healthcare emergency.
What happens now? Because you tried but didn't work. What happens now? Do you have any other tool left in your pocket?
Oh, we're going to keep fighting. And look, we've made great strides this week to get this on the map. You know, it was disappointing. We weren't even able to get a meeting with the minister when we were in Victoria to talk about this last week. That's why we wanted to declare an emergency. But we're going to request to have that urgent meeting with the minister. We're working closely with the Delta Hospital Foundation. We're also looking at other ideas. You know, cities like Colwood on Vancouver Island have said, look, we're not going to get resources from the province, so we're taking matters into our own hands, and they've gone and actually funded their own clinics. Now, I'm concerned about that. I'm concerned about the precedent of spending municipal tax dollars that should be going towards police officers and firefighters and Parks and Rec services on healthcare. But increasingly, that's what cities are looking to do because the province is failing. We've got a broken healthcare system. And like I said, it's not just Delta Hospital. When Delta's closed, that means bigger problems at Surrey Memorial. We're supposed to be opening a new hospital at Cloverdale in just a few years. How are we going to open a brand new hospital when we can't staff the hospitals that we already have?
I'm a bit curious to know why Delta doesn't have walk-in clinics.
Yeah, it's a serious concern. They've closed one after another. I think there's one left at Tawasin First Nation. But if you're a parent of young kids, as I am, and you've got a family physician that can't see you for 3 to 4 weeks, and you've got a concern and you can't get into a walk-in clinic, that Delta Hospital ER can be your only option. And that's why we're in crisis, because when people are experiencing the worst day of their lives or a family member's lives, they expect those services to be there. That's why people move to the Lower Mainland. It's the largest population center in British Columbia, because it's a guarantee that if you need services, they're going to be there. So it's caused great anxiety for a number of people who, again, have an expectation living in a country like Canada that you'll have access to the basics. This is not complex. This is getting the basics right. The core pillars of government are public safety and public health care, and we're failing on that metric right now, and it's downloading of responsibility onto local governments. It's not right, and we should ask for accountability for our leaders as to how we got here in the first place.
Councillor Dylan Kruger, one more question that I want to ask you about the law and order. Threatening calls and shootings that are happening. It used to be once in a while, but now it's more than one times. Every day is becoming the norm. Even though it's not that big of a problem, I assume, in Delta, but Surrey is really bad. You are a councillor in the neighboring city. What do you think about these shootings, and what do you think overall law and order situation in this area? And is there any better way to handle it? Delta has its own police, Surrey has its own police now, but people say that should be a more uniform approach towards policing.
Yeah, well, first of all, my heart goes out to business owners in the South Asian community who have been dealing with this very, very difficult issue in recent months. I was pleased to see some arrests made this morning. It's important that examples be made and that full weight of the law go upon these thugs, and that's what they are. There's no other way to call it but thugs. We're very proud of having Delta Police. I believe in Delta. Having our own municipal police force has served us very well, but we have to continue to be integrated. We know that crime doesn't stop on Scott Road. It doesn't respect municipal boundaries. So cities like Delta and Surrey and Langley and White Rock have to continue to work together, become more integrated. Because again, whether it's on our side of Scott Road or Surrey's side of Scott Road, we're one region, and we got to make sure that police have the resources to nab these thugs and throw them in jail.
Mr. Kruger, anything in the closing?
Yeah, just on healthcare, the hospitals are the heartbeat of our community. We have to, as a community, come together in these challenging moments and say, enough is enough. We're never going to stop defending our hospital. It is so important in a country like Canada that we have 24-hour, 7-day-a-week access to emergency care. That's the bare minimum standard. This provincial government is failing at that standard, and we're going to keep fighting until we get the health care that Delta and all of British Columbia deserves.
Thank you for your time and have a nice day, sir.
Thank you. You as well.